Hi, my name is Dr. Stephen Vath. I'm a board-certified plastic surgeon at the Center for Cosmetic Surgery. We have 2 locations in Denver and Golden, Colorado. I want to talk about drains with tummy tucks. It's the most hated part of tummy tucks for women, and you don't have to have them anymore. Here's how this went down. About a decade ago, actually more than that, it was in the late 90s, there were a couple papers published out of Texas that said, you don't need to use drains, and here's how you do it. You can use some stitches to quilt back down the layers of the tummy so that you don't need that horrible tube in there to evacuate fluid that can collect between the layers. This was revolutionary. It's a basic surgical premise that if you take apart 2 layers, then if you sew them back together, they will heal back together and you don't need a tube in. But it's been tradition, it's been convention in the plastic surgery profession with tummy tucks for decades to have these drains put in. Once that information was published, those people that published that information went and toured the plastic surgery meetings, and I saw them and listened to what they had to say. And this was approximately 8 years ago. It made sense. What was the downside? Potentially having a little bit more, higher number of fluid collections, which of course is very manageable and treatable and happens commonly when you use drains anyway, because once you pull the drains out, many people get those fluid collections anyway. So there was really very little downside at all, and I could always have gone back to drains at that point. So I stopped using drains cold turkey. And at that point, overnight, things changed. People came in at their week appointment and they weren't all bent over. I always thought it was because of the muscle tightening. It was the drains. The drains are miserable. They pull on the skin. People are scared of having them pulled out. And they came in at that week appointment knowing that was when they were going to get them pulled out, really quite frightened, weren't relieved until they were gone. And now you don't have to deal with that anymore. There's no more drains. Everyone, in my opinion, who's a candidate for a tummy tuck is a candidate for a no drain tummy tuck. I don't use drains on anybody anymore. So why are drains still being used? Why do you still read about it all over the internet? Why are most plastic surgeons still using drains? I quite honestly can't tell you the answer to that. I have not been doing this for 8 years now. I can tell you that it works. I can tell you that there's evidence that it works, plus my own experience on well over 1,000 people. There's a tendency in the medical field, understandably, to go along with convention and how you were trained and what you know. But there's also a place for making advancements when they're appropriate. And this was an advancement that made a big difference for my patient population. And now you no longer have to have drainage tubes by putting in quilting stitches and having the no drain tummy tuck.